someone is dead. Yes? So when you cannot feel their pulse, what is a pulse? So basically it's a heartbeat. Your pulse is your heartbeat, basically. Okay? So the moment you don't feel the pulse or the heartbeat of this casualty, not when they are not moving, not when you are calling them and they are not responding, no. It is when they don't have a pulse. Now, before you approach your casualty or your victim, there are steps that we follow. And step number 1 is, what are you supposed to do? Yes? Say that again. You have to assess the scene where that person has collapsed from, and make sure it is safe for who and who? And make sure it is safe for who? For you first, as the first aider, and then for the casualty. Are we together? So the first step, you have to assess. This is our scene. All these are our casualties. So we have to make sure we are safe. Now we are safe. Step number 2. Here you have assessed. This is our site. We have assessed to make sure that we are safe before we approach what? We approach our casualty. What is step number 2? You start. You start what? Tell us. CPR. Before you start CPR, remember we said for you to start CPR, something has to be missing. So how do you know it is missing? So you have to assess your casualty. Check for response. Pass. You call. Chief. Hello. Then from there, it's either they respond or they don't respond. So if they don't respond, we go to the. Should we go to the next step?
Yes.
Which is?
Check for pulse.
Which is?
Check for pulse.
AA. Which is?
Call for help.
You have to call for help. These are our casualties. This person is not conscious. We have confirmed they are unconscious or they are unresponsive. So the next thing is you have to call for help or instruct someone to call for help. As that person is calling for help, where do you go to? You check for pulse. In an adult, where do you check for pulse? So we use the carotid pulse. The pulse is here. Let's try and see. Let's try and see if we have. This is the angle of the jaw. Inside this depression, put 2 fingers. Don't talk, just put 2 fingers. What are you feeling?
Nothing.
Yes, that is the fastest to get. If you go to others, so you check between 5 and 10 seconds. Are we there? So, how do you know you are working on seconds? How do you count?
1,
Because you won't be.
2.
So,
3.
for 1 second to elapse, you say a 3-syllable word. For example, type. It is what? It is ta, I, ba. Those are 3. Ka, pa, ra. Okay? So, Kampala 1, Kampala 2, Kampala 3, Kampala 4. The pulse is not there. So if the pulse is not there, where do we go to next? So we have to start CPR. When you are giving CPR, you have to make sure that the chest is done what? The chest is exposed. You have to expose the chest of your casualty. Are we together? Once you expose the chest of your casualty, then we have to do something we call landmarking. You don't just compress anywhere. So we use the nipple line. Yes, we use the nipple line. And then you divide the nipple line into 2. And we want you to rest your hand on the sternum. Do all of us have a sternum?
Yes.
Do we all of us have a breastbone? This hard bone here. That is what we are calling the breastbone. Okay? Then you take the heel of your palm. Okay? And you place it. Let's have a casualty. I mean a first aider there, and the breastbone. Okay? Then you interlock. The palm should not be on the chest. It's just the heel. Are we there? Okay? don't sit on your, don't sit kneel above your casualty.
Hey, just
Come closer to your casualty, all of you. Hands straight, lock your elbows. Are we there? We're going to compress how many times? We are going to compress 30 times. Okay? Are we together? So we go? So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Okay? So once we reach there, what do we do next? No. What do we do again? We talked about 3 things. We talked about the heart. So we've worked on the heart.
the brain, the lungs.
So now we need to make sure that this person is getting oxygen. And how do we do that?
Kiss it.
Before you reach to the kiss of life. 1, ABC. 2, ABC. And then you continue.
Oh.
2. Yes. So head tilt, chin lift. Let's go. 1, ABC. Your casualty is dying. Your casualty is dying. Okay? Okay? Are we there?
Yeah.
Are we there? So it is 32. 32. How many cycles?
2 cycles.
How many cycles? How many times does your heart beat in 1 minute? 72 is average. 72 is for all of us. So 72 is average. So your heart beats between 60 to 100 times. So if you are compressing 30 and you are giving 2, and we are doing it for 5 cycles, at the end of the cycles, how many will we have? We will have 150 and we'll have 10, which is now within the normal ranges of a normal human being. Yes. So remember CPR. What does CPR stand for?
Simple.
Pulmonary resuscitation. Where C is for? C is for? Cardio. P is for?
Pulmonary.
Which pulmonary?
Pulmonary
So
is
connect it to
the lungs.
CPR.
Cardio, heart, pulmonary, lungs.
Lungs. And then resuscitation stands for?
Rejuvenating.
Resuscitation stands for?
Bringing back to
Bringing
life.
back to life. Okay?
I mean, if they don't respond,
Yeah?
they don't respond.
Yeah. Yours is to call us as we start doing it. So when we come in, we will come with other gadgets to help you resuscitate the casualty. Okay? Okay?
Okay.
So any question? Any question? Yes. Yes.